Welcome to the Gladden Longevity Podcast with Dr. Jeffrey Gladden, where our passion is helping you to become an age hacker. On this show, we want to help you optimize your life energy, longevity, health, and human performance with impactful and actionable information by answering 4 questions. How good can we be? How do we make 100 the new 30? How do we live well beyond 120? And how do we live young for a lifetime? I'm Steve Reiter and Dr. Gladden. We just wrapped up with Dr. Brian Cornblatt, who is the Chief Medical Officer of BioHarvest Sciences. And this company is absolutely fascinating in what they're doing in terms of growing these plant cells that are soup and stressing them out in these bioreactors and stressing them to the point where the resveratrol and other phytonutrients that these plant cells come out with, it's exponentially more than any product that's out there on the market. I'm getting this.
Yeah, this is one you definitely want to get. But it's a wonderful conversation. Brian's a really interesting guy. He's got a fascinating story. He's so passionate about what he's doing. You're going to love hearing this. And then when you hear the technology and you basically hear how much better you can be by using some of these products that are easy to get a hold of, you get them at the Gladden Longevity shop. It's really going to be remarkable. Trust me, this is not like a sales pitch or whatever. This is actually lots and lots of passion and some deep science that's going to kind of open your eyes in a way you haven't had them open before.
You use this product, Vinia, Vinia.
Oh, yeah. Yeah.
And we talk about that, and you're not an investor in this company. You just use this product, and you say it's one of the few supplements. You say this in the podcast. It's one of the few supplements that you actually feel better when you take it. You actually notice a difference. That's
right. Yeah. And this is special stuff. And their whole process and everything is super special. I think you're going to find this podcast so interesting.
And for listeners that are interested, there is a discount code there in our show notes to get this. And you can also use the podcast code, and you can also use the discount code podcast10 at gladdenlongevitysshop.com to get this and also the nitric oxide supplements that we talk about on the podcast and even a lot more. gladdenlongevitysshop.com.
Welcome, everybody, to this edition of the Gladden Longevity Podcast. I'm your host, Dr. Jeffrey Gladden, and I'm here today with Steve Reiter, my sometime co-host, who is, I'm always glad when he's here.
Yeah, most-time co-host. But
most-time co-host. All right, good.
How are things in Dallas?
Still chilly, but still driving around with a convertible top down. I'm dedicated to it. 13 degrees, no problem. Today it was only 26, so I was like, it's a breeze. Let's go. So, it's fun. Things are great, actually. Many things happening at Gladden Longevity, some super interesting things happening. We'll probably do a podcast without a guest just to bring the audience up to speed on that. We should schedule that.
We have that planned to record soon. It'll air in February.
Yeah. Okay. Well, we'll definitely do that. And how about for you? Anything going on there?
This weekend, I am likely going to be heading up to the mountains to get some cross-country skiing done, as well as next weekend, trying to get up towards Breckenridge, where I've got a couple high school buddies that I stay with, and get some great local skis in. And so it's
that's great.
And the mountains have been getting hit with snow.
Great. Love it. I need to get up there. Well, today we have a friend of mine, a guy who's become a friend, quite honestly, and also an amazing scientist, a guy named Brian Cornblatt.
Yeah.
And we're going to be talking with Brian about a really interesting technology and products that they're developing. So, Brian, welcome to the Gladden Longevity Podcast.
It's a pleasure to be here.
Yeah, great to have you. So, Brian, tell us a little bit about what got you interested in science, as a kid. Did you always want to be doing what you're doing now, or is this something that, you just kind of happened into? What? Tell us a little bit about that story.
If you would have told me in 1989, after I got my only C in high school in biology, that I'd be doing what I was doing today, I would think it was a joke. It was actually a tragedy that got me into this. Unfortunately, when I was a junior in high school, I lost a dear friend, Andy, to a rare form of cancer. He had something called neuroendothelioma, got put in a clinical trial here in Maryland at University of Maryland. And, my parents, my brother and I visited him almost every night for a good almost 5.5, 6 months. He was in the University of Maryland hospital. And during that time, I was really interested in playing soccer. This is the late 1980s. I love soccer. Nice. I taught it at a local camp and, maybe wanted to make that a career. But with Andy's tragedy, one of his doctors actually asked me if instead of being the soccer instructor at the camp that next summer, and this was before my senior year of high school, if I wanted to instead join them in the laboratory at University of Maryland Cancer Center. And I did, and it was just unbelievable, and it changed my whole career trajectory. And I wound up, for listeners in the audience, I wound up my C, the only C I had in high school was in biology. I wound up making that my major, and I excelled. Once I got started in the lab and really loved what I was doing and seeing the results, we were doing human clinical trials. We can talk about that later. I made that my major, and then from there I got into Johns Hopkins Medical School eventually, which was just, again, one of those things you could pinch me. I would have never thought I would have ever gotten into there, being a local kid and not really dreaming of being a doctor. But it was just an incredible kind of ride. But again, that the passing of Andy is what, to answer your question, what led me into that career in science.
Yeah, no, it's interesting. I think a lot of us get pulled into these careers for personal reasons, right? I'm in the longevity space for very personal reasons. You're in the space that you're in for very personal reasons. And I think for the audience listening, when you're working with people that are in it for very personal reasons, there's an integrity that they bring to the table. There's a passion that they bring to the table that just kind of exudes through everything that they're doing. And I think it's really commendable. I love working with people like that. And there are a lot of entrepreneurs in medicine and the longevity space who jump into it to earn a buck or make a buck doing a thing that's, kind of in vogue at the moment. But then there are people that are really passionate about making a significant impact for the planet and changing the glide path of aging and the course of healthcare, if you will. So it's really sweet to know that that's the space that you're coming from. So bring us up to speed. So you went to Johns Hopkins, and then what happened after that?
It's actually a great segue to what you just shared. I agree 100%. The other thing for listeners, if they're still trying to figure something out, I've always made helping others the top priority. And then the economic part, I always share, that will come secondary. And if you do something amazing, it will follow.
Right.
So, but if you make that your sole dream, I think you can end up failing, because too many people, too many friends and colleagues, when is enough? And they just keep striving for something that to me is unattainable. So my whole career has been focused on just helping others. And I think that's a much easier win, especially if you're in the healthcare science space. But to answer your question, I was actually in my second year, 1996. I was training to be a pediatric oncologist. So, wanted to treat kids with cancer. I went home to visit my parents, and my dad was going to the bathroom a lot. And I just learned about colorectal cancer the week before, and I figured, maybe I'll just check it out. So without getting too graphic, he had all the telltale signs in the bowl. I made him not flush, and he had, small pieces of stool, bright red blood. I actually examined him, and he had a tumor protruding from his rectum. So he had, colorectal cancer. I went back to school the next day. A surgeon called me. He had gone. I told him to promise me. I said it was probably hemorrhoids. I didn't want to scare the crap out of him. And to be honest, second year med students, I wasn't 100% certain, but to be fair, I was about 99% certain, unfortunately. So I got a call. He'd gone to his regular doctor, then a surgeon, oncologist, radiation oncologist, all within that first day. He had metastatic colorectal cancer. This is 1996. I tell people, we went online on the computer, amber screen. It's not like we have today. And he had a less than 1% chance of living out the year. This is in the fall. I, again, had the hope of being a person who treated cancer, but I got pretty pissed off at this point in time, for lack of better words. Just lost my friend Andy a few years prior, about to lose my own father. And I went through all the labs at Hopkins trying to see, is there any way we can prevent cancer in the first place? And this isn't that long ago, but it's amazing to think. 1996, we all believed that it was genes. It was almost like destiny and fate. But boy, were we wrong, and I went to all over the Hopkins campus, and I found 3 labs that were working. Only 4 years earlier, they found this amazing plant compound called glucoraphanin. We can talk about phytonutrients in plants, but this is a compound that when it gets converted in the human body or an insect or animal, it turns into sulforaphane, and they were actually showing it can block cancer in mice. So we immediately got my dad on broccoli sprouts. There was no product at the time yet. And then he did chemo radiation, spent 6 months. I can tell you, I just talked to him yesterday. We saved him twice. He had a recurrence that came back. My mom is also a colorectal cancer survivor, so I am plagued with genes that have been passed down over millennia. To your point, I use those personal experiences kind of for selfish reasons. I don't ever want to get colon cancer. And I spent over a decade learning genomics, and we can talk about that as well. So I'm part of a kind of a group, an initiative where we can actually do a one-time test in people and then figure out what they're vulnerable to, and then use plant-based compounds to really help afford protection from them. We can't necessarily say we can prevent diseases altogether, but we're pretty confident we can stave it off decades later. And hopefully, maybe you won't get it at all, given your genetic vulnerabilities.
Yeah, exactly. Which genetic test are you referring to here for cancer predisposition?
It's the one not far from where you're at, a little bit south. It's the Intellex DNA that was created by our friend and colleague, Dr. Sharon Hausman-Cohen and others. I've been with that group actually for over a decade now, before they were even a company. And a small story, when they first were growing, they didn't have the funds, and I would let them share some of the space in some of our booths when we went to some of the early medical conferences for them. But I've helped them over the years with their environmental detox panel and trained some of the nurses and physicians who are who become trained genomics experts and then have patients across the United States.
It's an interesting point that you bring up. So there are genetics companies out there that can look for genes that increase the risk for breast cancer, let's say like BRCA or PALB1 or different genes like this, or men that have genes that increase the risk for prostate cancer, or it could be even, sarcomas and things like this. So there's enough genetic testing out there to where genetically you can actually have a handle on, do I have a predisposition for a particular kind of cancer, like colon cancer or lung cancer or whatever? But the thing that people are probably aware of is that there's really a massive uptick in cancer. And I've just been reading recently that there's a big uptick in cancer in people under the age of 50, which is really kind of alarming. And the medical community, the sick care community, will say, is kind of scratching their heads about it. And yet there's so much indication that it's coming from higher levels of pollutants, right? So some of the fluorinated compounds that were made, Teflon and things like this, that have become kind of ubiquitous, have some very high cancer associated rates. Certainly all the petroleum products and all the things that get burned and et cetera, all the things in plastics. We're exposed to so many different toxins, if you will, that understanding your body's ability to detox becomes an absolutely critical thing if you're going to live on planet Earth in this day and age. So Intellex DNA is a wonderful DNA company. I've been working with them for probably about the last 5 years or 6 years. That's actually how Brian and I met. And we use their test on every client that comes in. But the point is that they don't do specific testing for cancer genes, right? They don't look for BRCA in their panels. However, what they're really exceptionally good at is looking at the detox pathways, as well as many, many other pathways that are critical, the metabolic pathways and cardiovascular disease risk pathways and things like this. But they do a really great job of outlining the risk of the SNPs and then basically interventions that can be done to either upregulate a gene or downregulate a gene. That gives people an opportunity to kind of modulate your own genetic expression. And I can't, to the audience, I can't emphasize enough how important it is that when you're living as we do on a toxic planet, that you have to know about your ability to detox. It's just absolutely critical. And sulforaphane, turns out, is a great upregulator of detox genetics, among other things, quite honestly. Do you want to talk a little bit more about sulforaphane? Maybe talk a little bit about the product that you helped develop around that?
Absolutely. And I want to touch upon a couple of the things you said. So for the audience out there, I don't want them to think that you get these genetic tests and then you're like, I thought in the 1990s when my dad was diagnosed with colon cancer that based on our genes, we're doomed. It's absolutely not the case at all. And to Jeff's point, it's this interplay between the genes that were endowed to us from our parents and then generations prior, plus our environmental exposures. And there's a stat that I learned many decades ago that the second we walk outside our door, and this could be in the Arctic if you're in a scientific exploratory camp there, we're exposed to 40,000 different chemicals on a given day. Right. And we can't wish this world away anymore. We're kind of stuck with it. And the beauty is, and for your listeners, again, so now what do? We have bad genes. We have all these chemicals. Well, the beautiful part is in all the cells of our body, there's a series of detoxification antioxidative enzymes. There's dozens of these, and they include the class of enzymes known as the glutathione transferases, the sulfotransferases. There's series of these genes. And what they do at the cellular level is they were actually, we co-evolve with plants, but they actually help us with our own chemicals that we make in our own cells during everyday living. And they actually metabolize. So most of these chemicals are produced in our body or come in from the outside, and they're fat soluble. And what this means is if we have a little bit of fat, it gets into our bloodstream, goes to our skin, the biggest organ of our body, gets into that fat tissue, takes up shop there, and it's not inert. It actually causes inflammation. So our inflammatory cells recognize it. It drives chronic low-level inflammation. And that's really, for the listeners, the main problem with our living today is this chronic low-level inflammation. But these enzymes, these phase 2 detoxifying enzymes, again, dozens of them at the cellular level, they take those fat-soluble compounds and they break it down, metabolize it through chemical reactions into water-soluble chemicals. And the beauty of that is once these chemicals and metabolites become water-soluble inside our cells and our body, we can remove them through feces, urine, and sweat. And so these chemicals can actually, and think of these chemicals can be broken down by these enzymes, these phase 2 enzymes. The phase 2 enzymes I like to share are kind of like a dimmer switch, a light. So they're on at low levels in our cells. And based on what we eat and based on life challenges, threats from the environment, we can ramp up the dimmer switch. And so to your question, I got interested in this compound glucoraphanin from broccoli. What we learned early on is that it helps at the cellular level to induce first the gene expression and then protein expression of dozens of these preventative and detoxifying enzymes at the cellular level. So we're ramping up the dimmer switch in proteins that really protect us from all those chemicals around us. So like me, I have these genetic threats from my parents, but I'm actually okay to be in the context of all these chemicals because I use the right supplements and these phytonutrients from plants to ramp up and turn on that light switch to really ramp up the production of these enzymes. So I'm safe now. I don't have to worry so much about chemicals that are all around me.
Exactly. And I think if you're listening to this, I think it's really smart, quite honestly, to know your genes and know what your predisposition is for cardiac disease or for dementia or for cancer. Really, it's kind of critical to know the cards that you're holding, because if you don't know the cards in your hand, you can't play the hand, right? You're just going down the road. You have no idea what you're doing. And yet when you know the genetics and then you actually understand that there are ways to modulate and upregulate and overcome some of the genetic challenges that each individual has, and that those genes are not a destiny, they're actually just a set of proclivities that you can manipulate, all of a sudden the power's back in your hand. And so if you understand these detox genes, you can go through and take the things that are critical for you, and it's never just one thing, but you can take the things that are critical for you to really, decrease your risk. So
the other fun thing about some of these genetics tests is it can actually foreshadow personalities. So I'm actually in the camp that every single baby that's born in the world should have this test. It's one and done. You take cheek swab and that's it. You get the results. I can give you an example. I'm pretty neat. If you were coming to my office, I have nice orderly desk and everything's in order, but I've never been diagnosed with OCD. Yet when I had my genes done and we did it, as a early tester, and then we looked, I have 3 or 4 of these genes that predispose me to being OCD and being orderly. There's interesting. Yeah. I also am very, like a lot of people, I think you would agree. I think, Jeff, you're like this as well. We do a lot of stuff. It's hard to go to sleep and turn off that brain that just wants to think and innovate and create new things or think about the next experiment.
That's it.
When we looked at my genes, I have deficiencies in some of the precursors that make the neurotransmitters. And for those who don't know about how the brain works, these neurotransmitters are chemicals that our body makes that determine our moods, our emotions, and really slowing up or taming our brain at night and throughout the day. So based on my genetic predispositions, I take something called 5-hydroxytryptophan. My wife does as well, so my kids do also. And this actually is a precursor, like an ingredient to make enough of the neurotransmitters so our brains aren't hardwired anymore to just be always on the on cycle. We're able to calm down, at night, get some good sleep, and then, wake up refreshed and ready to go again. So it's really pretty amazing what you can do with this information. And to your point, there's a lot of physicians and nurses who get trained in this, and they say prior to having the genomics for a patient, it was like flying an airplane without radar. And then once you give a pilot radar, they'll never fly a plane without that again. Once you give anybody that's treating sick care Americans right now in the United States with genomics, they'll never want to go back to treating people again blindly. And I say it's almost like just throwing darts at a dartboard. What are you going to give them? I mean, you're just, without knowing the genes, you're at risk of causing side effects, which can literally cause death and destruction to organs, where once you know the genes, you also can use that to prevent some of these tragic side effects that sick care, delivery is giving right now, day in and day out across the country.
Yeah. If you really don't understand, and this is the root cause of the root cause, let's say, right? The environment's part of the root cause, and then the genetics are a part of the root cause. The genomics are part of the root cause. If you're not working at that level, and again, we do this for every client we see, but if you're not working at that level, you're really kind of reduced to treating symptoms, right? You're really kind of reduced to treating symptoms and hoping that somehow helps. So I can't state enough how important it is to do this. And I've looked at lots of genetic tests, and I will tell you that the Intellex DNA is the best test that we've ever come across. So we actually push other genetic testing companies, because not every genetics company reports on every gene that you want to know about. We push other genetics companies to try to replicate the detail and the insightful recommendations that Intellex does. And so, but none of them have done it so far. I guess it's too much work. But I think it's a love language for these people that are doing Intellex too. They're incredibly passionate about it. So
it's a great team. Yeah, I help them as a scientific consultant. It's a great team. It's a lot of work behind the scenes. PhDs, MDs, working. Data mining, trying to find and what it is you don't just get your genes and your vulnerabilities. We call them SNPs or variables in our DNA. We actually have solutions as well, and these solutions aren't necessarily treatment. To your point, Jeff. In the longevity space, integrative functional medicine space, it's almost a world, and people sometimes challenge me. I got trained in Western medicine where you could, Steve, Jeff, I could give you 15 minutes and come back with 3 different diagnostic codes and 3 or 4 prescriptions, right? But all we're doing is masking symptoms. The world that I transitioned over into the last 30 years once I got into research is really this longevity, integrative functional medicine space. I'm going to shock people out there. I think the majority of diseases aren't even diseases. It's just perturbations or problems at the molecular level with certain pathways. And then we can transition into, I got involved in finding plant-based compounds that tackle maximum amount of these pathways to modulate them in a positive way to promote health span and health and wellness versus just masking symptoms. And we're really getting to the root causes of why people feel bad when they wake up, and it's really molecular perturbations, all due to the DNA we were kind of given, and then those environmental threats that we're exposed to. So it's a different way of looking at healthcare, and when you do it that way, we go back and we can really transition from sick care, which I was trained to do, into true healthcare and health promotion. And the work you do, Jeff, has been incredible. You've been a source of inspiration for me over the years. Longevity is nothing more than let's have a long life, but a quality life as well. And to do that, you really need to know your vulnerabilities. And instead of waiting for diseases to take hold, try to find the best lifestyle specific to you and your genes that will help you get to that lifespan where it's going to be a quality of life.
I couldn't agree more. That's exactly right. And just so the audience knows, we recorded, and I'm not sure if it will be released before this podcast or not, but we recorded a podcast with Sharon Cohen, who's the co-founder of Intellex DNA. And that's an interesting conversation. So if you're liking this part of the conversation, there's another podcast out there for you. It should be already out, or maybe it'll be out shortly. So Brian, let's transition a little bit into this concept of developing plant-based or finding plant-based molecules that can help modulate genetic expression. Continue the timeline. Where did you go from there? You worked with broccoli, you worked with getting sulforaphane and creating a very active form of sulforaphane called Abmacol. And maybe you can talk to people just about Abmacol, because there's a lot of sulforaphanes out there. Do you want to talk about that for just a second?
Sure. And let me go back to the story. So when my dad got sick, I went through all the labs, and there was this interesting lab, the Talley lab. They had one of the co-founders of this compound in broccoli and cruciferous vegetables called glucoraphanin. It's a phytonutrient. And let me just go back, and I want to answer your question, but why is it that all these plants have now about 500,000 phytonutrients that are available to us, for health promotion? And it turns out that unlike humans, plants are exposed to lots of stress. They're rooted into the ground. When it's hot or cold, too much rain, too much snow, too little rain, too little snow, not enough micronutrients, they can't move like us and find other resources. They're stuck. So what they've done and co-evolved over tens of millions of years is they've developed these phytonutrients as stress responders. What we've been able to do now as scientists is take these compounds, extract them when we have to, and then we test them in the laboratory. And what got me so excited in the Talley lab, here I had lost a friend to cancer. My dad got cancer. We were told it's from environmental chemical threats. There's a really interesting animal model where they take a chemical from chimney soot, creosid it's called dimethylbenzanthocene. You can give it to a developing female mouse, and then they will spontaneously get breast tumors. So we can create this model where we give chemicals from chimneys, just overlaid onto a mouse, and then they will get breast tumors. So what we do is we take in the lab lots of different chemicals and compounds, and we see how can we prevent that from happening. And it turned out that a year before my dad got his diagnosis, they had discovered that if you gave sulforaphane, and this is the end result. So again, glucoraphanin is found in plants. There's an enzyme myrasinase that's sequestered in the cell wall of, say, broccoli plants cells. And then when we chew it, the glucoraphanin and myrasinase, they come together. There's a chemical reaction called a hydrolysis reaction, and we create this chemical sulforaphane. And if you give sulforaphane to that animal model, you block the ability of these mice now to get breast tumors. So it's pretty amazing. We can actually use a compound from plants to prevent breast cancer in animals. So that became part of my project. I was now a third-year medical student. I was like, wow, this is amazing. You're doing it in animals. Any interest in doing it in humans? And without getting into too much details, we got a massive, more than $10 million grant from the National Institute of Health. It was called a SPORE grant to do anything we wanted with sulforaphane. And so I helped, and we wound up publishing the first true human clinical study looking at women at high risk for breast cancer. We, had them ingest before breast reduction surgeries, this sulforaphane compound we made in the lab. And then we looked at pharmacokinetics. This is what the body does to a compound. And then pharmacodynamics, what this compound sulforaphane does at the cellular level. Without getting too deep and complicated, at the molecular level, it does so many things, including inducing those phase 2 detoxification enzymes. It tames inflammation. It even induces a class of proteins called heat shock proteins. And that led to an amazing discovery in the autism space. At the time of our studies, we didn't have anything marketable. We would do studies all over the world, and then that was it. People couldn't get access to it. So I got recruited out of Hopkins, and then I went to Catholic Health for a little while to help them with the Genomics cancer laboratory. But then I got recruited out by a local company here in Maryland, used to be here, Nutramax Laboratories. The founder lost his first wife, to breast cancer. He had read the last publication I ever did in academia, 2007 publication in Oncogenesis about our breast cancer chemo prevention work. And he wondered why we didn't have a broccoli product on the market yet. And I said, that's the stuff of dreams. He had me take a tour of his facility, and the labs were better than anything I had seen at Hopkins. And after about 2 to 3 months, I joined them in 2010. I brought my wife out of Hopkins too. You met her. She's a cancer researcher as well. And we worked on a product line called Avmacol. And what it has is the glucoraphanin. It was the first to have the myrasinase enzyme, so everybody gets the benefit of sulforaphane production. And we backed it up now with over 21 human clinical studies all over the world, everything from cancer prevention studies, schizophrenia studies, depression, autism, some really, really fascinating work. The stuff that you would think about in pharma, we were doing in the kind of the dietary supplement space. So it was a really exciting chapter of my career.
Yeah, that's incredible. Steve, it looked like you might be wanting to ask a question. No, you're good. Okay. Well, let's keep rolling here. So, yeah, it's a beautiful story. And we've been using Avmacol now for, ever since I heard about it, which was probably about 5-6 years ago. And then from there, you've moved on and you're doing some other innovative things in this whole space of bringing plant products to the masses to really optimize health. So tell us a little bit about where you are now.
Yeah, and so my career trajectory, I wanted to start, treating cancer. I even was in the anti-cancer drug development program. I was in the MD Ph.D. program. So I was trained to make new oncology drugs. But then after discovering this amazing ability of plants and their compounds to stave off certain illnesses, I was like, boy, I want to create compounds to help people not get sick in the first place. But then after doing that for decades, and I know I look young, I turned 50 in October, I'm ready to just prevent diseases altogether. So where is that going to happen? It's with our diet. And 70% of all chronic diseases, sometimes more, are because of the food we eat. And they're loaded with chemicals, glyphosate. It could be a whole nother podcast. But what I was really interested in doing is taking some of the worst food out there and making it healthy. Like as an example, how cool would it be to eat a tortilla chip? And instead of having to regret it afterwards, we actually are now eating this tortilla chip and it's preventing the common cold. And that's not far-fetched. And I'll tell you what happened. So during COVID, we had an inability to get the broccoli compounds to make our Avmacol. So we had a supply chain issue. It was due to drought and then people getting sick and a whole bunch of factors. And serendipitously, I got connected to this amazing person, Ilan Sobel, the CEO of BioHarvest. It's a company that's now largely based in Israel. And what they did is something amazing. They don't need any fields to grow their plants or plant-based compounds. Instead, over 16 years, they developed amazing biotechnology, and they created these bioreactors where we don't need any chemicals, we don't need any soil, we don't use heavy metals. It's all done with water and natural compounds. And just like I shared about 10 minutes ago, how plants, they have stresses, and to combat those stresses, they make these phytonutrients. When we grow these plant cells in these bioreactors, we stress the heck out of these plants. So every time we're done with a batch and we end up with powders after 21 days, we quantitate the amount of phytonutrients, and they're significantly higher than the world has ever seen. So the beautiful thing is we can take any plant out there. We don't need enough. We lock it in perpetuity. It takes about 1.5 years for our plant biologists to come up with the right conditions, and then we can make amazing end products. Our first one was done with red grape cells, and we have a product on the market called Vinia, and that's actually delivering piceid resveratrol and a whole bunch of dozens of other phytonutrients. We're about to launch an olive-based product. We have a pomegranate product, and then the sky's the limit. We have, our bioreactors. We have many of them ready to try different plant compounds, and so it's been an incredible journey. Again, instead of and give you an example what this does to speeding up technology. If you and I and Steve wanted to start growing grapes, we get a seed from a friend. We plant it into our into the ground, use lots of chemicals, and we'd have to wait a whole year to get the first growth cycle. And then if we're lucky, every 6 months thereafter. In our bioreactors, every 21 days, we're producing massive amounts of kilograms of red grape powder. Again, it contains massive amounts of phytonutrients, these health-promoting phytonutrients. So we've actually taken nature and sped it up exponentially, and we've also created more and more of these phytonutrients. We don't change the chemistry, we just change the ratio. So every time we grow something, it's a new patent, a new IP when we take a new plant. So that's exciting as well. And that's where pharma got lost. They started with plants, and then they ran out of patents. So they started synthesizing stuff. And for the crowd, imagine that chemical sulforaphane, and people did this, and then you can't patent that anymore. So they would put like a hydroxy group in OH or methyl group CH3. It doesn't sound like it's big change. We've actually tested some of these in humans. It can cause renal failure and other things. And why is that? The body no longer recognizes it as a plant-based compound. With that small, subtle chemical change, our immune cells recognizes it as a foreign invader, and it mounts an immune response. And that's why when we're watching Jeopardy or Wheel of Fortune, every one of those drug commercials say in the middle of the night, your arm could fall off, your kidney could shut down, you could die. It's because we're synthesizing all these compounds. They're not healthy for us, but what we do is we just take the plant compounds, and we don't have any disclaimers that your arm is going to fall off in the middle of your sleep. And that's a stretch for sure, but it's not that far-fetched that some of these synthetic compounds are really harmful. And what I want to do is get away from that as much as we can.
This episode of the Gladden Longevity Podcast is brought to you by the new Gladden Longevity Blood Vessel Formula. The Mediterranean diet is often associated with heart health and longevity, and while red wine is often highlighted, it's actually the herbs traditionally used in this diet where the real magic is.
And Mediterranean herbs such as summer savory, basil, rosemary, and tarragon contain potent antioxidants that have been found to inhibit something called RNOx activity. And RNOx is a major promoter of oxidative stress in the arterial wall, which causes the arteries to age, increases blood pressure, decreases sexual function, etc.
I love that this formula has summer savory because I've never seen it in the fresh herbs section at any of my local grocery stores, even the health ones like Natural Grocers. And to get these benefits in a tincture, brilliant, Dr. Gladden.
Well, I'll tell you, I've heard from our clients and from my own use of it that they love it as well. I just take a few drops or a dropper full and put it in my tea. It is alcohol-based. Tincture is the nutrients are extracted with ethyl alcohol. I drop it in my tea, it tastes good, or I drop it in water, it tastes good. And it's so nice to know that you're getting those health benefits to keep your arteries young. We love it.
Get 10% off your order of the new Gladden Longevity Blood Vessel Formula when you use the code podcast10 at gladdenlongevityshop.com. That's podcast10 at checkout when you visit gladdenlongevityshop.com.
If you want to live young for a lifetime, keeping your blood vessels healthy is key. So check out the new Gladden Longevity Blood Vessel Formula to assist you in your quest to make 100 the new 30.
Brian, When you say coming out of these bioreactors, it's exponentially more. Like, give the listeners an idea of how much more resveratrol you're able to produce than, say, just getting it from regular grapes and even some of the best grapes you can find in the world.
Yeah, and remember this, the problem, and I've been a plant biologist, plant scientist for decades, you go to the same grower, and if you do it on the fields, you could, if we're looking at grapes, one batch might get you 13% piceid or regular resveratrol, another batch only 5, and then 7. It changes over time. Once we lock it in our bioreactors, it's locked, and we can make it that way for perpetuity. But to your question, 1,000 table grapes worth of piceid resveratrol, and in one of our 400 milligrams capsules of Vinia each day. So 1,000 table grapes. And that's a mess. It would drive diabetes in every listener. The amount of glucose you would be consuming and fructose is astronomical. And we have very little, if any, other compounds. It's pure plant compounds. And then we're loaded with something called polyphenols. And every 400 milligrams, you get more than 40 milligrams of these supercharged polyphenols. And something else I want the audience to know when we're talking about plant compounds, remember I told you we have these enzymes in our body that make these metabolites so we can pee, sweat, or poop it out of our body. Plant compounds are exactly the same. They're recognized as foreign, so when they enter our body, we metabolize them. And the plants metabolize these phytonutrients also. So no one kind of plant phytonutrient is created the same. And in the case of resveratrol, there's cis and trans resveratrol, which are in about 300 of our competitor products. And then we call it the gold standard of resveratrol is piceid resveratrol. The difference there is when we grow these in our bioreactors.
Spell that for the audience, piceid, because
yes.
Yeah, go ahead.
PICEID, and it's just a different metabolite. So you have cis and trans resveratrol is most common in things like Japanese knotweed and grapes. And there's a small amount of piceid resveratrol normally. But when we stress them out and grow it in our bioreactors, our main metabolite is the piceid resveratrol. Why it's better? Cis and trans resveratrol has only 1% solubility. So we swallow a tablet or a capsule of grapes. It goes into our lumen of our GI tract, and then you have to get it into the bloodstream through the wall. Only 1 out of 100 will get through there. With the piceid resveratrol, it has a glycoside group. Nature does this. We're not changing chemistry. They do it anyway, but nature does this, and we amplify it. And that now has a 72% solubility. So we need very little to then get it across into the bloodstream. The other interesting thing in terms of pharmacokinetics, once it's in your bloodstream, how long do these compounds last? You want them to last a long time. Cis and trans, we can't measure it a half an hour after it ends up in your bloodstream. Piceid, we can still measure it 12 hours after you take a single dose. So it's long-lived, and it's creating this health promotion at the cellular level for many, many hours versus just less than an hour. So it's really important when you go out and buy supplements to look at what type of metabolite are you getting, because it makes a world of difference. And most people don't know this, and it's a real shame. It's a lot of education goes into finding the right supplements.
I agree. Yeah. It takes a lot of education to find the right supplements. Yeah, we've been very impressed with the Vinia, actually. You feel a difference when you take it, actually. It's pretty interesting. And I don't feel every supplement that I take. There are a few supplements that I take that I do definitely feel something, Vinia being one of them.
Wow.
The other thing is it seems to have a nice impact on blood flow and cardiovascular health and sexual health. And I know there have been reports. Now, you've been collecting reports from users. Maybe just share with the audience how many users have been reporting back to you and what some of the things that they're reporting using the Vinia, because I think it's interesting. It was interesting for me to hear this.
Yeah, so first of all, we've only launched the product about 2 years ago. There were 16 years of R&D to develop the bioreactors. Vinia is kind of like our test case, our proof of concept that we can take something out of these bioreactors, very safe, very sterile, non-synthetic, and get it out as a health promotion product, nutraceutical, we call it. We have over 35,000 customers. We have thousands of responses. Literally every night, we spontaneously just getting people's kind of feedback on what's happening. Let me share, though, because you're, in my mind, one of the world's preeminent longevity experts. And one of our dear friends, Gary Brecka, has this saying that I love: the absence of oxygen is the presence of disease. And again, I'll repeat it. The absence of oxygen is the presence of disease. And when we get older, there's two, this is going to be really easy. So I know I've talked a lot. I talk fast. I get excited. But there's two compounds I want your audience to learn about. One of them is nitric oxide. And then the other one is endothelin-1. We call it ET1. So when we're younger, we have a lot of nitric oxide and very little endothelin-1. And what impact that has on all of our blood vessels is it leads to dilation. So we're opening up the lumen of our blood vessels, allowing oxygen and nutrients to get to our cells, and then waste products to get from our cells and removed from our body. But as we get older, NO goes down and endothelin 1 goes up. And so our vessels start to constrict, so we don't get as much oxygen and nutrients to, say, the far reaches of our brain. And even a guy like me, before I started taking Vinia, I'd go downstairs sometimes, I'm not going to lie, and I'd be like, uh-oh, why did I come downstairs? Well, once I'm on Vinia, I don't have that brain fog anymore. And why that happens, again, is because as we constrict our vessels, we're not getting oxygen and nutrients to our cells. We're not making ATP and everything the cells need for energy. And so that's a big deal to be able to get more blood flow to all our organs and all those vital cellular micronutrients and oxygen. So that's one of the main mechanisms, is we're able to dilate vessels. And we did a human clinical study, showing that. We also have other pathways, as we've talked about. We, just like sulforaphane, we're able to induce dozens of detoxifying antioxidative enzymes. Within the first hours of taking this product, you could go and do a blood draw, and we can measure in peripheral blood mononuclear cells, the mRNA and then protein expression. So we do that. We tame inflammation as well. So the feedback we get mostly is on that I'm allowed to share. We're a nutraceutical company. I can tell you, Jeff, off the record, the amount of stuff that we're doing for people who have, quote unquote, those diseases that our Western MD friends, like to dole out, and I'm not knocking on them. What we do to tame that is absolutely incredible, and the stuff of dreams. But what I can talk about more freely as a nutraceutical dietary supplement manufacturer is we're helping with mental clarity. We're helping with energy levels. So we have a lot of older clients who take our products who used to have an afternoon nap. They don't need it anymore. And I might have told you, Jeff, I have a Tempur-Pedic bed. It's pretty cool. It has this little analytics device that goes behind your head, under your pillow. I don't think it has a lot of EMF waves, so I might be killing myself here doing this, but I get 18 analytics every night. And what I do, and I take my supplements 5 days on and I take off on the weekends, my REM and deep sleep go through the charts on the days I take the Vinia, and then it drops when I don't, and then it comes back, and then it drops, it comes back. So we have done clinical trials where we show we can induce a series of genes called clock genes that regulate our sleep-wake cycles. So we can actually peel back the need for afternoon naps and have you have the best, most restful sleep you can ever imagine. And this will just happen at night. Yeah. So I don't know if you've experienced that as well.
I like to take it twice a day, to tell you the truth. I like to take it in the morning and the evening for those reasons. It's interesting on the longevity front, too. We're talking about sort of things that people can experience. But on the longevity front, this piceid resveratrol does some really nice things in gene modulation also. It upregulates a gene called klotho, which also happens to now be added to the Intellex DNA panels, the ability to measure klotho. And we actually, in our offices here, we can measure blood levels of klotho also, which is interesting. But being able to upregulate klotho, improves inflammation, oxidative stress. People that have the right amount of klotho, or the ability to make the right amount of klotho, live significantly longer. They have less kidney disease, less vascular disease, things like that. So that's really interesting. And then it also has the ability to upregulate things like AMPK and sirtuins, which David Sinclair has shown all the value of sirtuins in terms of potentiating DNA repair and some of these rejuvenating factors, right? And so when you're taking these plants, and it's why we're kind of plant-based in our diets, because these plants have these stress-induced chemicals that just do miraculous things for the body across wide spectrums of things. Like if you're taking this piceid resveratrol, you're not just getting longevity benefits, you're getting all these other benefits, right? It's quite fascinating. It's hard to beat, quite honestly.
Yeah, and I want to add, if I can, about the klotho. So it turns out an interesting stat. I learned this from Sharon, our friend, Dr. Sharon Hausman-Cohen. 75% of the population listening today, on average, the cohort that's listening, they have decreased levels of klotho. And you can actually Google after you listen to this podcast today, if you Google klotho knockout mice, it's pretty interesting. You'll see if you can actually remove klotho from a mouse, they look all straggly, they don't gain as much weight, and then they die weeks prior to the other mice that have normal klotho levels. And the beauty of resveratrol and the quercetin that's in our Vinia is actually induces klotho levels. So for the 75% of us that have decreased ability to make on a normal level klotho, it's like that dimmer switch I was sharing with those phase 2 enzymes. We can increase klotho. There's two other genes that are really interesting related to longevity.
Let me just interrupt you for a quick. Please. Let me interrupt you for a second. So if you want to look that up, it's spelled KLOTHO, klotho. but it's with a K, not a C. So if you want to look up what he's talking about, KLOTHO. Okay.
That's correct. And then I would say go to Google Images, because if you go to the regular publications, I mean, we'd be glad to help you walk through it. They're a little complicated, but if you just do Clotho knockout mice images, it's beautiful. You'll see night and day between Clotho. You'll see plus. That means they have 2 good copies of the gene. And then if they have 1 or 2 missing genes, it's dramatic just visually what happens to these mice. And that happens to humans as well.
You know what's interesting in humans? It's really what's fascinating about humans is that if you have 2 copies of the bad SNP, let's say the bad SNP, then you actually, that's a very small percentage of the population. I want to say it's around 6 or 10% or somewhere in that neighborhood. And those people are the people that really have trouble exercising. Like they hate to exercise, they never like to exercise, things like that. And when they get Clotho increased, all of a sudden their energy levels come back. On the other side, the 75% that are homozygous have 2 quote unquote good SNPs. Those people actually have better Clotho, but they don't have the best Clotho. It turns out as the people that have 1 good SNP and 1 quote unquote bad SNP that make the most Clotho.
Really?
And so that's unusual in genetics, because normally it's the person that's, if you got 2 good SNPs, then, you're like, say, COMT gene, your ability to metabolize catecholamines is 4 times what it is if you're in the middle, which is 2 times what it is if you don't have either, right? So, but here, if you know your Clotho genes or you're interested, you want to be heterozygous. If you got that, you got a gift, right? You got a gift from the universe. But the beautiful thing is that if you can boost Clotho, no matter where you're coming from genetically, that's such a wonderful thing. And that's why I like to take it twice a day, because who doesn't want more Clotho?
And you bring up something, as a scientist, I love looking for patterns in nature. So the plants, there's a term that I don't know if you've spoken about this in some of your prior podcasts. There's a term called hormesis, which is exactly what you just described.
Many times.
What hormesis is for the audience is if you have too low of something, it may not work. It could even be harmful. If you have too high of something, it may not work. It probably is definitely going to be harmful. So there's this kind of middle factor that's important for phytonutrient, Clotho, most of the things that we are discovering in nature. There's this happy medium. And when people ask me, well, what is my specific happy medium? Everybody has a unique happy medium. So no 2 Vinia users are going to ever have the exact same outcome. To be honest, they probably never going to have the exact same dosing. So when we do, and one of the beauties of what I do, I'm the chief medical officer for BioHarvest, the creators of Vinia. We get to go around the world creating clinical trials, and we're gonna be working with you, Jeff, soon on God willing,
do a clinical trial. And I have I'll just say I have no financial interest in the company. We're going to do a clinical trial with them because we want to see exactly what can it do in the longevity field. So,
and what we're going to do though is a dose-defining study, because again, each person is going to be a little bit different. And again, using genomics, we'll be able to tell. I can tell what the dose is knowing the genomics, but most people don't have it going into a trial, so we have to figure that out after. But that's just some of the neat stuff. So again, too little or too much of anything can be disadvantageous. So that's exactly the story you described with Clotho. It's just one copy is more than enough, and that's exactly the right amount. There's 2 other genes I wanted to talk about in longevity space: FOXO3 and NRF2, and both of those also are miraculously modulated by the phytonutrients that we have in Vinia. So the top 3 genes, and you can Google these as well, is Clotho, FOXO3, and NRF2, and all those are modulated by Vinia and the phytonutrient compounds that are in there. So we got pretty lucky there, and I'm hoping that this is really the fountain of youth. But we got to be careful when we say things like that. We really have to go ahead and do these clinical trials and studies and make sure that we can back that up. But in the animal world, well, that's what I get involved in as well. We can do some really nice studies where we don't have to sacrifice animals at all. We'll always try to keep them alive or adopt them out when we're using other types of species, but we can actually see and do studies on longevity in the animals, and that always hopefully translates into human beings as well.
Mm-hmm. Yeah. No, absolutely. Yeah. We've said many, many times on the podcast that biology is an economy of balance. It's not how much can you have or how little can you have, or can I be keto all the time, or I should sit in the sauna 10 hours a day. It's not like that. It's an economy of balance. And so the same is true here with these supplements and with Clotho and everything else. But what's wonderful is it's difficult to have something that will boost Clotho, increase FOXO4, not FOXO4, but FOXO3, and then also increase NRF, which decreases inflammation, right? So being able to hit that trifecta it's really quite wonderful. That's why we want to do the study. We want to see what can it actually do.
Exactly. And we can come back and we'll tell you what the studies are. As a matter of fact, it might be a good way to plug participation by giving a little synopsis of what we're putting together, because it's going to be, it really is. It's not anything to tackle diseases. We're trying to help with health span and lifespan. And what I touched upon earlier, we want you to live a long life, but have a good quality of life while doing that.
Yeah, absolutely. And do you want to just talk about your olive product for a minute? What's going on with that?
Sure. So again, people can look it up afterwards if they want to get deeper information. But olives, this is part of the Mediterranean diet. And it's interesting. We produce right now our products in Israel, is where our bioreactors are. And a lot of people there live that Mediterranean diet lifestyle. And this includes grapes and olives and pomegranates. And those are the first three things we're actually working on. But what olives contain are three major phytonutrients. And these are hydroxytyrosol. And then it gets metabolized, again, just like any chemical, it gets metabolized by the plants and humans and animals into oleuropein. And that's even more anti-inflammatory and antioxidative. And then the creme de la creme, kind of gold standard, think about it like the piceid resveratrol, is a verbascoside metabolite of hydroxytyrosol. So hydroxytyrosol is great. We use it a lot in like joint health products. You can see that all over the world for taming inflammation, helping the joints. But then its better metabolite is oleuropein, and then the best is verbascoside. We struck gold again when we put this through our bioreactors. We make so much more verbascoside than you can find in nature, like significantly more. To your question, Steve, how much more? It's a lot. You would need, literally bowls and bowls of olives to get what we're going to deliver in one capsule. So we're real excited. We have this compound, and we're actually working now on some clinical trials. I just had a call this morning. I'll be able to tell you a little bit more about it in the months ahead when we get this trial going. But again, it's for something for longevity and tackling some of the chemical insults that can happen to some of the organs in our body. And we're using this compound to tame that inflammation, chronic low-level inflammation, and upregulate some of these genes that at the cellular level can protect us from the environment. So a lot of good stuff out there.
Yeah, awesome. It's really amazing the work you guys are doing. And I'll just mention that the CEO of the company, I believe, you correct me if I'm wrong, but I believe he worked with Coca-Cola for a number of years. And he's basically had a come to the light moment and has left that world and is now basically either repaying his debts or just trying to optimize health. But it's kind of a really interesting story in and of itself, of somebody who's creating such an innovative approach to optimizing health. So interesting story.
Yeah, and his name's Ilan Sobel. He's an incredible human being. And you're right, we like to joke around. He's almost like repenting for all the days that he globally spread some of those products. But he also worked on some of the healthy waters too. So it wasn't all the bad stuff that we now know are associated with diseases.
Well, God didn't strike him down, so I guess, yeah.
Yeah, but he likes to wake up now, and he has a better, higher purpose. And who doesn't want to wake up, like you and all of us? Just trying to help fellow human beings. I mean, it's one of the best feelings, as you alluded to, when we get these responses from customers. I wake up, every morning with in my inbox 8 to 10 reviews that come our way, and it's awesome. Just to know that we're making a positive impact on people's lives with something as simple as these compounds that come from plants. It's a nice thing to be working on.
Yeah, no, we love it. Steve, any other questions you want to ask at this point?
I guess this is a question for both of you. You talked about nitric oxide, how it decreases over time. We interviewed Dr. Nathan Bryan back on episode 215, talking about the importance, did a real deep dive on nitric oxide. Dr. Gladden and Brian, I guess a question for you both. Would stacking Vinia and a nitric oxide supplement like Dr. Bryan's NO2U, would that almost exponentially help?
Yes, it does. I've been stacking it, quite honestly. And there's another product called Vascanox that also boosts dietary nitrate, if you will, so that if you have more of this in your system, which can be converted to, in the saliva, is converted to nitrite, and that nitrite is used to make nitric oxide. It's not really the L-arginine pathway at this point in time. So I know I'm getting a little technical. The point is that when you eat plants that are rich in dietary nitrate, like kale and arugula and spinach and beets and things like this, you're basically giving your body the fuel to make nitric oxide. So what Vinia is doing is basically potentiating, I believe, the genetics to make nitric oxide, decreasing vasoconstriction, right? So now that's good for blood pressure. It's also good for sexual function and good blood flow. Now you add in another supplement that's boosting the substrate that the body needs to make the nitric oxide. And if you drop something in on top of it, like Neo40, which can actually, or nitric oxide U, which actually causes you to make nitric oxide right now. Now all of a sudden, if you want to be a teenager again, this is a good way to do it. So it's super cool. Yeah.
Yeah, and I agree. And based on my genes, I take actually over 10 different supplements a day. There's no one size fits all out there. And what you'll see is based on genes.
That's right.
If you go to, a practice like Jeff, he'll look at all the different, vulnerabilities you have. And nobody's just going to be leaving there probably with one generalized supplement. You usually package these things together. People might get a little confused and say, I thought you were just talking about hormesis. It isn't too much of a good thing bad. It turns out every single compound has its own kind of range. So in the case of nitric oxide, we have to go really, really high. I mean, almost to unattainable levels to where I think it becomes really something that's going to be harmful. And you're not going to hit that with what Dr. Gladden just talked about there. So absolutely. And I do want to share one other interesting thing. When I first started working on this, I was worried. I'm an avid cyclist on the weekends and in the mornings. I have a Peloton, so I ride indoors. Right now it's snowing here in Maryland. I can't get out there, but I do in the spring and fall and summer. It's beautiful out here in Maryland. But one of the things I was concerned about is if you increase nitric oxide, what's going to happen to me? I already have an athletic heart. My blood pressure is great. Do I have to worry? We have these fail-safe kind of mechanisms at the biologic level, molecular level, where that's not an issue. So we actually even carried out a study, it's not published yet, with Vinia in professional cyclists. And what we showed is we were able to drop the blood pressure a little bit, but it wasn't to such a low level where you get something called orthostatic hypotension, where every time you stand up, you feel like you're in a faint. It actually just kind of promotes good and beneficial blood pressure, but it doesn't get it to catastrophically low levels. So again, there's a lot more than just nitric oxide that goes into our overall blood pressure. And we have little sensors that monitor this and help us keep us in a good level. So I just wanted to share that with the audience as well.
Yeah, and I think there may be people out there that are using PDE5 inhibitors, which are things like Cialis and drugs like that. So Viagra. The point, though, is that when people are using those drugs, they basically work by blocking the degradation of nitric oxide. And everything that we're talking about is augmenting the production of nitric oxide and then decreasing the vasoconstriction with the ET1. So it turns out that you can safely, even if you're on a PDE5 inhibitor like Viagra or Cialis, you can actually take things that boost nitric oxide because it doesn't overshoot. The body doesn't overshoot on that. And it's interesting that that's the case because a lot of times those drugs don't work, right? They don't work for ED. I think it's in 40% of people, they don't actually work. And the reason is they don't work is because you can't save what you don't have. So if you're not producing nitric oxide, there's nothing to save. So you're not going to get any benefit from the Cialis or the Viagra. So really, the way that we've always focused is on the supply side. And so we have very few people that need Viagra or Cialis, but if they do, it's not been a problem. But just so you understand the context here around this whole nitric oxide conversation, because there's the medical side, which is the Viagra and Cialis, and then the supply side. But I think a healthy diet full of these high nitrate foods, a few of these supplements that we talked about, which are available in the Gladden Longevity shop, all of this can lead to, really, really robust cardiovascular function, which is, sexual function is kind of the canary in the coal mine when it comes to that. If you're having erectile issues, you've got vascular problems, right? And there are other reasons to have erectile dysfunction. It can be psychological, it can be nerve damage, there can be some other reasons. But if it's blood vessel related, this is pretty much like a magic bullet, I think. So.
And I want to add on the fundamental thing of what you shared there. And this is no knock on pharma. I learned about pharma for my 13 years while I was at Hopkins. There's a time and place for it. But the problem is, and this also, I see this in psychiatry, we're giving neurotransmitter kind of blockers when the person might not even be making the neurotransmitter in the first place. So you wonder why they fail. And that's the whole reason, again, that flying without radar. So not knowing the root cause, it's so important. And to your point, Dr. Gladden, people with ED out there, it could be anatomic, nerve injury, maybe during prostate surgery, stress, even something else. We got to figure out that root cause before we just willy-nilly start throwing drugs or even supplements at it, because, we really got to make sure that you only have so much time on this planet. You only have so much resources. I don't want anybody to spend excess resources on something that's not going to help them, and especially if it's going to harm them. And that's where, it's important. Practitioners like you who spend their days trying to figure out the root cause, they're the heroes to me out there, because for too long we haven't been doing that, and we need to go back. That is the roots of medicine. Back in the old days, and people often ask, like, you do great stuff, you think you'll win the Nobel Prize? I'm like, absolutely not, because all I'm doing is medicine that used to be practiced 2,000 years ago. We used to use plants, roots, and rhizomes. We got away from it into this synthetic world of, I go off on a tangent on that one, but we're just going back to how medicine used to be, and it was health promotion, not sick care. And we got lost along the way. And it's a whole other podcast that I can come back and talk. But we're driving really just healthcare here and health and wellness promotion with these plant compounds at the end of the day.
Yeah, we love it. We love it. Yeah, we're totally synchronized on this. So, Brian, it's been such a pleasure to have you on. What a wonderful conversation. Really appreciate your time and all the insights that you shared with us. Thank you.
No, absolutely. And thanks for being such a great mentor and friend.
Oh, my pleasure.
And for any listeners that are interested in the show notes, we're going to have a coupon code, a discount code for Vinia. So you can go to vinia.com and use the promo code that is in our show notes. Thank you for listening to this week's episode of the Gladden Longevity Podcast. If you would like more information on what we've discussed or other topics, please reference the show notes or go to gladdenlongevitypodcast.com. You can also find us on Instagram, Facebook, and Twitter by searching Gladden Longevity. If you've enjoyed this podcast, please subscribe to get future episodes delivered to you and share our podcast or this episode with someone in your life that you may find benefit. Thank you for listening. We'll be back next week with another exciting episode. The Gladden Longevity Podcast is provided for informational purposes only. It does not constitute medical advice. This content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of a physician or other qualified health provider with any questions you may have regarding a medical condition. The use of any information and materials linked to this podcast is at the listener's own risk.